integrity, we expand the horizons of your future to the future that is evolving in this change of regulatory environment that we're living in. We work not only with clinical acumen and documentation, but medical necessity, coding guidelines, and a very, very important component, which is compliance. Clinical acumen, documentation. We can help, one of our roles is to help communicate the role of medical record documentation, its direct relationship to diagnostic related group assignment and application and administrative data to promote physician buy-in of the clinical documentation integrity program, because this is one of the most major components that needs to be done, and that is to bring physicians into the queue to help improve documentation of the patient care, not just clinical documentation, but the documentation requirements of third-party payers that may be significantly different from what is taught in medical school and residency programs today. Expanding horizons regarding medical necessity. We help the participants to understand outpatient observation services versus inpatient designations, the documentation requirements, what you need to know to stay on the right course, what compliance requires of you. We help define and practically apply documentation requirements for supporting patient observation status. We help you to understand the condition code 44 and what it really means to you and how to implement it appropriately. This is just a tip of the iceberg of how we introduce and discuss the components of medical necessity along with appropriate documentation to teach you and to work with you in practically applying it compliantly. Coding guidelines. We help especially non-coders to apply general coding guidelines to case studies, including recognition of principal and secondary diagnoses. We help conceptualize the general principles and workings of ICD-9 coding and its relationship to DRG assignment under the Center for Medicare and Medicaid Services, DRGs, and transition into MSDRGs, ICD-9, as well as segue to ICD-10. Again, this is but a tip of the iceberg of all the components that we help to bring together for those within the organization and within the jobs and professional areas of clinical documentation integrity. How we can help you through compliance. This is so important. Compliance, fraud and abuse, which is when compliance is not adhered to, and clinical documentation integrity. We help you to discuss and to understand the legal consequences of fraud and abuse on healthcare providers and organizations. We help you to understand exactly what fraud and abuse is and how we can be attempting to do what we consider appropriate and correct, but can be interpreted as fraudulent or abusive if it is not done correctly. And we help communicate the tools that regulatory agencies use to enforce the regulations of compliance. And through understanding this, it will help you to provide not only appropriate but compliant documentation and communication of coding and medical necessity as needed. Why documentation integrity is important? Because medical record documentation facilitates the ability of the physician and other healthcare professionals to evaluate and plan the patient's immediate treatment and to monitor his or her health care over time. Communication and continuity of care among physicians and other healthcare professionals involved in the patient's care. Appropriate utilization review and quality of care evaluations. This helps capture appropriate quality of care efficiently and effectively throughout health care. Accurate and timely claims review and payment, and collection of data that may be useful in research and for education in the future. How we can help. CDI, our clinical documentation program, has a long history and proven track record. We are the oldest clinical documentation improvement / clinical documentation integrity program in the United States. We were founded in 2007 and had our first clinical documentation improvement program in January of 2008. We have modified as the needs of healthcare environment has changed, and that is why we have evolved to the certification in clinical documentation integrity, because this is where healthcare environment is going today. The Association for Integrity in Healthcare Documentation has shown you the doorway to your future through this CDI program. Want to see what's on the other side? Then come visit us at our Certification in Clinical Documentation Integrity Institute. You can go to our website for the Association for Integrity in Healthcare Documentation, www.aihcd.com, or contact us through our career counselors at 239-280-4262. We look forward to hearing from you, and I look forward to meeting you. Thank you, and have a great day.